there are certain specific adverse events related to that are immune-related. So we call them IRAEs, or immune-related adverse events. And adverse events, of course, occur with any drug, but we're specifically interested in those that are immune-related because those are unique and those are treatable and have to be understood and managed in a different way than we have been used to, because in the past, we really haven't had this kind of a side effect profile for our drugs and have not learned how to manage them historically, and we're learning that now as we move forward. And then the MAP kinase pathway targeting, which is of course very, very important, very effective, and has a very unique set of toxicities that honestly some of us never expected to see. Very much targeting the skin toxicities. We'll talk about those in some detail. Musculoskeletal toxicities such as joint pains, muscle pains, and so on. Fever, very unique. Fever that's not related to infection, and this can be sometimes a problem to manage. And then the unique ocular toxicities that come up with some of the MEK inhibitors that are very important to know about and recognize, because as a clinician, you're not going to recognize that or able to even examine that in a regular oncology clinic. So let's move to our polling question number 1. Common toxicities of checkpoint pathway inhibitors include A, skin rash and alopecia, B, diarrhea and skin rash, C, alopecia and diarrhea, and D, skin rash, diarrhea, and alopecia. So let's take your selections here.
You know, one of the questions that I often get asked on this topic is, do I think that practicing physicians are getting more comfortable with handling the side effects of checkpoint protein inhibition? What do you think happens in your practice, meaning amongst your colleagues in that part of the country that you practice? Do you think people are becoming more comfortable?
Oh, no doubt. I think people are becoming more comfortable. I think, you know, it depends on how proactive the community oncologist is, but at least the ones I work with are very interested in learning more, and they're getting more comfortable. You know, they have some nervousness associated with it, I think, but they are learning more how to manage it. They're learning that steroids are not a no-no in managing these patients, something which was always sort of thought of before. And I think with good guidance, they're learning it well.
Yeah, I think in our part of the country, in Florida, I think docs are getting more comfortable. It used to break down: a third of patients docs would use it, a third would never use it in a million years, and a third were undecided. I think most of the undecided is becoming a yes, and now it's about 2/3 would use it, and 1/3 would still refer to the academic center for the use of those drugs. So the result is that 2/3, about 60% of the respondents agreed that it was B, and 20% split with C and D
Interesting.
each.
Yeah. So here, I guess the point was, you know, how common is alopecia with checkpoint inhibition? And I really haven't seen that as a common side effect. Have you?
I haven't seen it. It's technically listed, but I just haven't seen it as a real potential side effect in I don't know, 800 or 900 patients that I've treated.
Yeah, indeed.
So
it's certainly not a common toxicity. It can occur, as can so many other things, but I think the common ones, I would agree with the majority of the audience that it's really diarrhea and a skin rash that we often see, and the ones that we're worried about.